Hi again, this is Dr. Katie Ray of New Day, and today I'd like to answer some frequently asked questions that people often have when they're starting care with me. I go into all these questions in greater depth at the Level 1 workshop, so if you haven't been to the workshop yet, please look at your calendar and plan on coming. In the meantime, I'd like to talk to you about having an open adjusting room. So that's what it's called, to have an open room and have 3 tables. It's an open adjusting room. And I found out that when I ask people if they know why I have an open adjusting room, that they'll often say they don't know, or they'll say, maybe it's because it's easier for you. It is easier for me, but that's not the reason why I do it. I actually do it because it's part of your care that helps you. So when I have you on the table and I'm checking through your spine, and then I find that place where I'm going to do a light contact, it's optimal to give your system a couple moments to respond to what I just did. And it's actually better for you to be able to respond without me standing over you waiting for a response because I want to do what's going to happen next. So it's really nice that I can do a little bit of work with you and then go over to the table of somebody else and do a little bit of work with them. It gives your system time to respond, and then when I come back to you, I get to check again and see what your system would like me to do now. So it's very helpful for the timing and for encouraging your body to get that response that we want, which is we want your body to, pick up the ball and run with it. Also, there is an energetic benefit to being in a room healing with other people. If this sounds strange to you, consider the difference between going to a yoga class versus doing yoga at home by yourself. When you're in the class, there's some benefit to it besides just that there's a teacher there. There's some feel, there's some momentum that you wouldn't get if you were doing it alone at home. That is part of the benefit that you're getting to getting care from me in the open room. So next time you're laying on the table, if you're there by yourself, you'll get a great session. If you're there and there's people on the other tables, you might even get a better session. Another frequently asked question that I get in care is, what am I doing when I'm feeling all the way down your spine to your tailbone, and then it kind of seems like I'm touching your butt? Which I am. But what I'm really doing is I'm contacting a ligament that goes from your tailbone over to the bone you sit on. It's a very important ligament. It's called the sacrotuberous ligament. And there's actually an entire chiropractic technique that is designed around accessing that ligament and using it to affect the spine, because the ligament basically is anchoring your spine to your pelvis. So when I do that little light touch that is right at the end of your tailbone, I'm affecting your whole spine and doing it in a way that some people find surprising, but at the same time, when you get used to it, it should be relaxing for you and you should be able to feel the effects through your whole body. Another question I frequently get is, how long is this process going to take? In network care, we have these different levels. There's these different outcomes we're looking for, but really, how long is it going to take to start getting results? You can start getting results in as soon as 1 visit in terms of feeling lighter in your body, feeling changes in your posture, feeling more focused in life, all because we've changed the programming in your nervous system. Now, in the beginning of your care, it is very helpful for you to come in for your visits as frequently as possible. Often this is 2 or 3 times a week, because your body needs that reinforcement so that you can live a greater and greater percentage of your life with your body and nervous system running the new programs rather than the old painful programs that are holding on to the tension. Transitioning from level 1 care into level 2. And level 2, I have a video where I talk about it more, but level 2 is that more transformative, energizing aspect of care. Getting from level 1 to level 2 takes different amounts of time depending on who you are, of course. But I would say 1 to 3 months is about what you can expect. So if you're coming for your visits as frequently as I'd like you to, if you're doing the work at home, the somatorespiratory integration exercises, you're coming to the workshops, you're learning, you're actively involved in the process, it's likely to take a shorter amount of time for you to get the results you want, and if it's what you desire, getting from level 1 into level 2.